Hello, good morning. My name is Monica. Today I am going to explain ankle strategy, which is one of the most important balance control mechanism used by the human body in physiotherapy. Understanding ankle strategy is essential because it helps us assess and treat patient with balance impairment and neurological disorder and fall risk. Whenever a person is standing upright, the body is constantly experiencing small movement called postural sway. Even during quiet standing, the center of gravity is never completely still to prevent falling. The nervous system continuously makes small correction. The most common method used for this correction is the ankle strategy. Definition of ankle strategy. Ankle strategy is a postural control mechanism in which balance is maintained by generating corrective movement around the ankle joint. It is typically used when a person is standing on a firm, stable surface and experience a small and slow perturbation. During these strategies, the entire body moves as a single rigid segment similar to an inverted pendulum, with its ankle joint acting as a pivot joint. The main goals of ankle strategy is to keep the body center of mass within the base of support and prevent a loss of balance. Biomechanics of ankle strategy. To understand ankle strategy, we first need to understand the concept of an inverted pendulum. Imagine a pendulum hanging from the ceiling. It naturally remains stable because its center of mass is below the pivot point. However, the human body is different. During standing, the center of mass is located above the ankle joint, making the body inherently unstable. Therefore, constant muscular activity is required to maintain balance. When a perturbation occurs, the body rotates around the ankle joint while maintaining alignment between the head, trunk, pelvis, and legs. Instead of bending at multiple joints, the body behaves as one unit. Neuromuscular response during forward sway. Let us consider a situation where the body sways forward as the body leans forward. The center of mass moves anteriorly. This causes stretching of the posterior muscle of the lower limb. Sensory receptor immediately detect this movement. Muscle spindles detect muscle stretch. Joint receptor detect ankle movement. Plantar mechanism receptor detect changes in foot pressure. The sensory information is transmitted to the central nervous system. The sensory information is transmitted to the central nervous system, which rapidly generated a corrective response. The muscles are activated in a specific sequence known as the distal to proximal pattern. First is gastrocnemius, second is hamstring, third is paraspinal muscles. Neuromuscular response during backward sway. When the body sways backward, the center of mass shifts posteriorly. The nervous system responds by activating on the anterior aspect of the body. The activation sequence is tibialis, anterior quadriceps abdominal muscle. This muscle generates a dorsiflexion toward at the ankle, bringing the body forward and reestablishing for postural stability. Role of sensory system. Ankle strategy depend on the integration of three major sensory systems. First is somatosensory system. This is the primary sensory system involved in ankle strategy. It provides information about joint position, muscle length, pressure distribution under the feet. Second is visual system. Vision help determine the body orientation related to the environment. Third is vestibular system. The vestibular apparatus located in the inner ear detected head movement, linear acceleration, gravitational Orientation. Clinical signification in physiotherapy. Ankle strategy plays a major role in rehabilitation patients with neurological or musculoskeletal disorder, often dominant impaired ankle strategy, leading to poor balance and increased fall risk. Example: stroke, Parkinson's disease, peripheral neuropathy. First is stroke. Stroke patient may have weakness or delayed muscle activation around the ankle, reducing their ability to perform effective postural correction. Second is Parkinson's disease. Patient often exhibit regarding and reduced automatic postural response, resulting in impaired ankle strategy. Third is peripheral neuropathy. Loss of sensory feedback from the feet decrease the effectiveness of ankle-based balance control. Fourth is elderly population. Age-related reduction in muscle strength, proprioception and reaction time can impair ankle strategy and contribute to falls. Physiotherapy assessment. Static standing assessment, postural sway analysis, functional reach test, balance testing, Berg balance scale. Physiotherapy management and training. Balance training. Exercise performed on firm surface, foam surface and balancer board. Strengthening exercise. Gastrocnemius, soleus, tibialis, anterior peroneal muscle. Proprioceptive training includes single leg standing, wobble board exercise, dynamic balance task. Okay, thank you.